Corneal opacities. Peripheral. Description. There are several conditions that lead to exclusively peripheral opacifications of the cornea. The more important conditions affecting the peripheral cornea, such as marginal keratitis, Terrian marginal degeneration, conjunctival intraepithelial neoplasia (CIN), and Morin ulcer, are dealt with in separate articles, whereas more benign lesions are dealt with here. The peripheral nature of these conditions probably reflects the main difference that exists between the peripheral and central cornea, its close proximity to limbal blood vessels. Bulk white limbal girdle. This is a very common, totally benign, exclusively peripheral corneal lesion. The appearance is that of a chalky white crescent-shaped lesion within the anterior stroma of the interpalpebral cornea. It is usually, but not always, separate from the limbus. It can affect either the nasal and/or the temporal cornea and is most exclusively seen in older people. No treatment is required. Arcus cyanoid, as the name indicates, is a crescent-shaped degenerative change that affects the peripheral cornea. It is extremely common, affecting almost all people over 80 years of age. It is usually not associated with any systemic disease, although it may rarely be associated with abnormal blood lipids. It may also occur in a rarely inherited corneal disorder, Schneider crystalline dystrophy. Blood lipid disturbances are associated with atherosclerotic disease, stroke, and heart attack. Any suspicious presentations of Arcus cyanoid, such as in a younger patient, or if it's particularly dense or extensive, should be investigated with serum lipids. The lesion initially occur in the superior and inferior limbal area, limbal cornea, and extend to involve the whole of the peripheral cornea. There is usually a clear zone between the arcus and the limbus. Occasionally, the cornea within this peripheral clear zone can become thin. This usually only occurs in quite elderly people and is referred to as a peripheral furrow. Histologically, lipid is first deposited in decimate membrane and then in the anterior stroma. This leads to the formation of two triangles, apex to apex, visible both clinically and histologically. Wilson's ring or Kaiser-Fleischer ring. Wilson's disease is a rare inherited metabolic disease affecting normal copper metabolism. It results in both the liver and central neurological dysfunction. Excess copper is deposited in the peripheral cornea, where it binds to a receptor protein in decimate membrane, leading to an orange-colored opacity, a Kaiser-Fleischer ring. This can also occur with chronic liver failure, resulting in elevated serum copper levels. Management. No treatment is required for Volk's white limbal girdle or the majority of cases of Arcus cyanoid.